In 1960, a visit to your family doctor in America cost $2. Not $200, not $2,000, $2. You walked in, you saw the doctor, he knew your name, he knew your kids, and when it was over, you handed him $2 and walked out the door. A 3-day hospital stay to have a baby? $46. Total. Not per hour, not per night. $46 for the entire stay. And that included everything. The room, the nurses, the delivery, everything. But here is the part that really hurts. In 1960, over 68% of Americans had private health insurance, most of it paid for entirely by their employer. You didn't have to shop for a plan. You didn't have to compare deductibles. You didn't have to argue with an insurance company about whether your doctor was in network. You got a job, you got health care, and your family was covered. That was the deal, and it worked. This is the story of how America had the perfect healthcare system, and the one decision that destroyed it. To understand how good we had it, you have to go back to World War II. In 1942, the country was at war, and there was a problem. Factories needed workers, but the government had frozen wages to prevent inflation. Companies couldn't offer higher pay to attract employees, so they started offering something else instead: health insurance. It started as a workaround, a creative way to compete for workers without breaking the rules. But then something happened that nobody expected. The IRS ruled that employer-provided health insurance would be tax-free. The company could write it off as a business expense, and the worker didn't have to pay taxes on it either. Overnight, health insurance became the best deal in America, and companies started falling over themselves to offer it. By the late 1950s, the American healthcare system was the envy of the world. You had a family doctor, a real doctor who came to your house when your kid was sick, who knew your medical history by memory, who charged you what you could afford. If you needed to go to the hospital, you went to the hospital. There were no pre-approvals, no referral networks, no claims denied for insufficient medical necessity. You got sick, you got treated, you got better, you went home. Hospitals were run by communities, by churches, by universities. They were not-for-profit institutions whose mission was to take care of people. The idea that a hospital would exist to make money for shareholders would have sounded like a joke in 1960, and the costs were manageable. In 1960, the entire country spent $146 per person per year on health care. Total. That was 5% of the nation's entire economy. Americans spent more on cigarettes than they did on medical bills. Doctors made a good living, but they weren't millionaires. Nurses were respected. Hospitals were clean and well-staffed. And if you had a job, any job, from a factory floor to a corner office, you and your family had health coverage. It wasn't perfect. There were gaps, especially for the poor and the elderly. But for the vast majority of working Americans, the system worked. It was simple, it was affordable, and it was there when you needed it. And then the costs started to climb. By the late 1960s, something had shifted. Medical costs between 1950 and 1970 rose by 125%, more than double the rate of general inflation. New drugs, new technology, new procedures, they all cost money. Medicare and Medicaid, created in 1965 to cover the elderly and the poor, flooded the system with new patients and new dollars. Hospital bills started creeping up, then jumping up, then exploding. By the early 1970s, healthcare costs were rising so fast that they had become a political crisis. Something had to be done. And that is when Richard Nixon made the decision that changed American healthcare forever. On December 29, 1973, President Nixon signed the Health Maintenance Organization Act into law. Now, on the surface, this sounded reasonable. The idea was simple. Instead of paying doctors for every visit and every procedure, which gave them an incentive to do more, you would pay a flat fee to something called an HMO, a Health Maintenance Organization. The HMO would keep you healthy, and because they received a fixed payment regardless of how much care they provided, the idea was that they would focus on prevention rather than treatment. Spend less, keep people healthier, save money. That was the pitch. But there was a detail buried inside this idea that would eventually poison the entire system. In a private recording from the Oval Office, Nixon was told by his advisor that the beauty of the HMO model was that, and this is a direct quote, The less care they give them, the more money they make. And Nixon's response? He said, "Fine, that sounds like it could work." Think about that for a moment. The foundational logic of the new American healthcare model was that the less care a patient receives, the more profit the company makes. That was not an unintended consequence. That was the design. The HMO Act required any employer with 25 or more workers who offered traditional insurance to also offer an HMO option. It provided federal grants and loans to set up new HMOs across the country, and it overruled state laws that had previously restricted managed care organizations. At first, the HMOs were required to be not-for-profit. The original law specifically said these organizations should exist to serve patients, not shareholders. But that requirement didn't last long. During the 1980s, under the wave of deregulation that swept through Washington, the not-for-profit requirement was removed. And that single change, that one regulatory rollback, opened the floodgates. Within years, for-profit HMOs exploded across the country. Wall Street got involved. Insurance companies merged, grew, went public, and started trading on the stock exchange. Healthcare was no longer a service, it was an industry, and its primary obligation was no longer to patients, it was to shareholders. And that is when everything changed for the average American. Suddenly, you couldn't just go see any doctor. You had a network. If your doctor wasn't in the network, you paid more, or you didn't go at all. Suddenly, your doctor couldn't just order a test or prescribe a treatment. They had to get pre-authorization from the insurance company first, a company whose profits depended on saying no. Suddenly, there were deductibles, co-pays, out-of-pocket maximums, coinsurance, prior authorizations, referral requirements, formulary restrictions, and 100 other terms that no regular person could understand, all designed to put barriers between you and the care you needed. In 1978, 95% of Americans with employer health insurance had traditional indemnity plans, where you could see any doctor and your insurance simply paid the bill. By 1998, just 20 years later, that number had dropped to 14%. In a single generation, the old system was gone. And the costs? They didn't go down, they went up. They went up faster than anyone imagined. In 1960, America spent $146 per person per year on health care. By 2024, that number was $15,474 per person per year. Healthcare went from 5% of the economy to 18%, and American families started going bankrupt just trying to stay alive. Today, a single night in an American hospital costs over $3,000. A doctor's visit without insurance costs between $80 and $170. An ambulance ride can cost you $2,000 before you even get to the emergency room. And here is the part that should make you angry. The companies that were supposed to cut costs and keep people healthy, the HMOs and the managed care giants, their CEOs now earn tens of millions of dollars a year. The top 5 health insurance companies in America reported combined profits of over $30 billion in a single year. $30 billion from a system that was originally designed to be not-for-profit. Your grandmother walked into a doctor's office, paid $2, and went home healthy. Today, Americans avoid going to the doctor because they are afraid of what it will cost. They cut pills in half to make prescriptions last longer. They drive themselves to the hospital instead of calling an ambulance because they cannot afford the ride. We had a healthcare system where your employer covered you, your doctor knew you, and the hospital existed to heal you. It wasn't run by Wall Street, it wasn't managed by algorithms, and nobody went bankrupt because they got sick. And then one decision, one law signed in 1973, cracked the door open for profit to enter the system. And once profit got in, it consumed everything. The $2 doctor visit is gone. The $46 hospital stay is gone. The family physician who made house calls and charged what you could afford, he is gone too. We didn't lose our healthcare system to some foreign enemy or natural disaster. We lost it to a simple idea that healthcare could be a business, that the less care you provide, the more money you make. And the strangest part? We were warned. It was right there on a tape recording in the Oval Office. The less care they give them, the more money they make. And the President of the United States heard those words, nodded, and signed the bill anyway. And that is the story of how America had the perfect healthcare system and the one decision that destroyed it. If you remember the days when a doctor's visit didn't require a second mortgage, leave a comment below. Tell me what healthcare was like when you were growing up. And if you have not already, hit that subscribe button and join us here at Vintage America, because there are a lot more stories like this one. Stories about the America we used to know. I will see you in the next one.